Hello, my name is Dr. Love Pusky, and I'm here to talk to you today about bacterial vaginosis. The truth about bacterial vaginosis. Once again, I am Dr. Love Pusky. Thank you, Vutch, and I am here to talk to you today about bacterial vaginosis. Any woman can get bacterial vaginosis. Having bacterial vaginosis can increase your chance of getting an STD. What is bacterial vaginosis? What is it? That's a good question. Thank you for asking me. Bacterial vaginosis, BV, is a condition that happens when there is too much of certain bacteria in the vagina. This changes the normal balance of bacteria in the vagina. How common is bacterial vaginosis? Bacterial vaginosis is the most common vaginal condition in women ages between 15 and 44. How is bacterial vaginosis spread? Thank you very much for asking me that question, because that's exactly where I was going to tell you. Researchers do not know the cause of BV or how some women get it. We do know that the condition typically occurs in the sexually active women. So if you are sexually active, you are more common to deal with this. BV is linked to an imbalance of good and harmful bacteria that are normally found in a woman's vagina. Having a new sex partner or multiple sex partners, as well as douching, can upset the balance of bacteria in the vagina. This places a woman at increased risk for getting BV. We also do not know how sex contributes to BV. There is no research shown that treating a sexual partner affects whether or not a woman gets BV. Having BV can increase your chances of getting other STDs. So having this bacterial vaginosis will increase your chances of getting other STDs. BV rarely affects women who never have sex. So if you never have sex, you rarely get affected by this vaginosis, bacterial vaginosis. You cannot get BP from toilet seats, bedding, or swimming pools. Thank God. So you can go swimming. I would still recommend, if you're going to use a public restroom, to not sit on the toilet. But at home, you will not get it from your toilet. You will not get it from your bedding. And you will not get it from a swimming pool. How can I avoid getting bacterial vaginosis? Doctors and scientists do not completely know or understand how BV spreads. There are known best ways to prevent it. The best way to prevent having bacterial vaginosis, number one, is not having sex. Not having sex. Limit your number of sexual partners. Limit your number of sexual partners. Not douching and using latex condoms the right way every time you have sex. I'm pregnant. How does bacterial vaginosis affect my baby? Pregnant women can get BV. Pregnant women with BV are more likely to have babies born premature early, or with low birth weight, than pregnant women without BV. Low birth weight means having a baby that weighs less than 5.5 pounds at birth. Treatment is especially important for pregnant women. How do I know if I have bacterial vaginosis? Thank you for asking me, because I was just about to tell you. Many women with BV do not have symptoms. If you do not have symptoms, you may notice a thin, white or gray vaginal discharge, pain itching or burning in the vagina, a strong fish-like odor, especially after sex, burning when urinating, itching around the outside of the vagina. So that is how you may know if you are experiencing any of these symptoms. That's how you know that you may have bacterial vaginosis. How will my doctor know if I have bacterial vaginosis? A healthcare provider will examine your vagina for signs of vaginal discharge. Your provider can also perform laboratory tests on a simple or vaginal fluid to determine if BV is present. Can bacterial vaginosis be cured? Thank you for asking, because I was going to tell you. BV will sometimes go away without treatment, sometimes. But if you have symptoms of BV, you should be checked and treated. It is very important that you take all of the medicine prescribed to you, even if your symptoms go away. A healthcare provider can treat BV with antibiotics, but VV may return even after treatment. Treatment may also reduce the risk from some STDs. Male sex partners of women diagnosed with BV generally do not need to be treated. BV may be transferred between female sex partners. Whatever happened. What happens if I don't get treated? Thank you for asking me, because I was going to tell you. BV can cause some serious risk, including increasing your chance of getting HIV. If you have sex with someone who is infected with HIV. If you are HIV positive, increasing your chance of passing HIV to your sex partner. Making it more likely that you will deliver your baby too early if you have BV while pregnant. Increasing your chance of getting other STDs such as chlamydia, gonorrhea. These bacteria can sometimes cause pelvic inflammatory diseases called PID, which can make it difficult or impossible for you to have children. Thank you very much for listening and tuning in to my very informative video. Today I am Dr. Love Pooski. I only come around to bring great information and helpful health information to everyone out there that I can reach. I don't come out for any reason. I thank you for listening. I hope that you learned something from this video. If you could subscribe or like this video, I would appreciate that as well. Again, I am Dr. Love Pooski, and I hope you are having a great, awesome day. And I will be back with you with more information, with more helpful information in my next video. Thank you very much. Goodbye.